Hi, my name is Dr. Ramesh. I am an oculoplastic surgeon. I have offices in Somerset and Livingston, New Jersey. So patients can have lack of feeling in the eye, and that can be either from having a brain tumor surgery or from having a shingles or herpes outbreak in the eye. Various things can cause it, but if your eye can't feel, it has a very difficult time staying moist, and you can lose vision. Some patients even lost their eye, unfortunately, from this condition. A lot of times patients don't have symptoms because you don't feel. And the condition by nature is usually painless. So typically patients have decreased vision or their eye may start to look white, but it's something that the earlier you recognize it, the better it will be treated before you sustain scar tissue and prolonged damage. So there are anesthesiometers or special instruments that we use to test how sensitive someone's cornea is so we can see based on where they should be, where they are, and whether it's worth doing medicine or worth doing surgery to fix that. So there are over-the-counter treatment options, so teardrops. There are medications, so oxyrvate is one medicine that we can use to help regrow some of these nerves. And on the severe end, when patients really have no function, surgery is a great option. Well, when a cornea doesn't have healthy nerves, you have to grow healthy nerves onto the cornea from another part of the face that does have healthy nerves. So whether that's on the other side of the face or from the cheek, wherever it is, we help tunnel those nerves onto the diseased eye so that those nerves can sprout and regain the function. And this process takes about 6 to 12 months after the surgery, but it's very consistent and patients really have improvement in their corneal clarity and their vision afterwards. Before, we used to have to harvest nerves from other parts of your body. Now we can actually use nerve grafts that are available to us that preclude the need for harvesting from another donor site. So it's about an hour and a half surgery. Patients will be asleep. We do the procedure. You'll have a patch for about a week or two, and then the patch is removed. And then we wait for the nerves to recover. That process can take 6 to 12 months. You use some drops in the meantime. And slowly, week by week, month by month, the corneal sensation and the clearness of the cornea improves. Well, the main outcome is vision. So we want to have improvement in the vision because of the surgery. Sometimes this requires us to do a corneal transplant at the same time if the diseased cornea has been present for so long that the cornea has turned white. If it's early on, we can just do the nerve grafting procedure and obtain improvement in vision. So the success rate, of course, depends on the patient and the reason why they have the disease. So if you have continual shingles outbreaks, for example, then you may need to be on long-term medicine to prevent reactivation of that disease. But patients who, for example, had surgery and lost the nerve function that way typically do very well because they're not having repeated surgeries that might injure those nerves. So surgery is typically well tolerated because we're able to use off-the-shelf nerve grafts. The surgery time is less and the risk of a donor site is not there. So patients typically do better now than they did in the beginning stages when we were developing the surgery a few years ago. Patients are candidates for surgery if they have an insensate cornea. So this is checked by having your eye doctor evaluate your eye, see how dry it is, and then measure the function with either a cotton tip or an anesthesiometer.